Hello, I'm Dr. Nadim Geloo, Senior Medical Director for Abbott's Structural Heart Division. I'm a board-certified cardiologist, and I'm here to answer cardiovascular questions sent in by members of the Abbott HeartMates community. Let's have a heart-to-heart. So let's check the HeartMates inbox. And this question is from a HeartMates community member, Linda, from Virginia. What's actually happening when I feel heart palpitations? That's a great question, Linda. Our heart beats nice and regular. And it beats so nice and regular that we become used to it. We don't ever know what's going on, and we don't feel our heart beating. However, when something different happens, we can feel that. And that's what's described by folks as heart palpitations. While most of these episodes are benign and not harmful, heart palpitations in more rare circumstances can be signs of heart disease. And that's why it's really important for you to connect with your physician and have a conversation and ensure that more testing does not need to be done. But generally, these are benign. Our next question is from Charles from Minnesota. And Charles would like to ask, do most important predictors from a cardiovascular problem vary with age? As we age, our risk of heart disease goes up. And that's usually related to the fact that we typically develop heart problems due to hypertension, due to diabetes that typically occur with age. Younger folks can have different types of heart problems. They're typically related to congenital heart disease, which means that they were born with something that was already wrong with their heart. Young people can also have heart problems that are more rare, such as rhythm abnormalities that make them pass out, or congenital problems which they inherited from other family members, such as a cardiomyopathy where the heart muscle is very thick. Let's go to our next question. And this is from Chris Donges, and Chris is one of our HeartMates draftees from Delaware, and he asks, what are some early signs of heart failure that people should look out for? Heart failure is a very serious cardiac condition that can actually lead to hospitalizations. It can even lead to a shorter life. So it's important to identify causes of heart failure. And some of the symptoms of heart failure are shortness of breath with activity, getting short of breath when you lay down, swelling in your ankles, an increase in weight that's not explained over a short period of time. All of these things can be signs of heart failure. Heart failure generally happens when the pumping function of the heart is not keeping up, and so blood begins to back up. Now, blood can back up in a variety of ways. It can back up in the lungs, and if that happens, you get shortness of breath, but it can also back up in the tissues of the body, and that's what causes the swelling and the increase in weight. So I hope that answers your question. The important thing is whenever you have any of these symptoms, please don't ignore them. Connect with your physician and make sure you don't need further testing. Let's go to our next question. And this question is from Zeke Mankins, another HeartMates draftee, and his father, Chad. And they ask, which is more serious, right ventricular heart failure or left ventricular heart failure? In order for me to answer that question, I'll need a heart model. We have a heart model.
Here you go, Doc.
Thanks for that handoff, Damar. What an unexpected surprise. That was Damar Hamlin, our most famous HeartMates team member. Thanks again, Damar. The heart is actually two pumps, a right-sided pump and a left-sided pump. The right-sided pump is responsible for collecting deoxygenated blood that's come back from the body. So the tissues have used the oxygen that's come to them, and the blood is now devoid of oxygen and has carbon dioxide in it, and it returns to this chamber here. This is called the right atrium. This is a collecting chamber. Once this is nice and full with deoxygenated blood, there's a valve called the tricuspid valve, which is right here. This valve opens. Blood drains down into what's called the right ventricle, which is a muscular chamber. And once it's nice and full, this valve closes. The right ventricle squeezes, and it squeezes blood into an artery called the pulmonary artery, which forces the blood into the lungs. And then if we look on this side, This is the left atrium, which then collects, it's the collecting chamber that collects the rich oxygenated blood from the lungs. It's returned back from the lungs. And when this is nice and full, this valve called the mitral valve opens up to allow blood to flow into this pumping chamber. And if you notice, the left-sided pumping chamber is thicker because it really has to pump blood all the way down to the toes. And so it's a more muscular chamber. The blood is then pumped from that chamber into the aorta and then out to the body. As far as the seriousness goes, well, they're both serious, but they do both present differently. There's different symptoms, and there's different manifestations and different consequences. And importantly, there are different evaluations and different therapies. So it's important to connect with your physician to try to find out if you're having symptoms of heart failure, and if you are, if it's from the right side or the left side, because again, it's different pathways to therapy. Well, that's all the time we have for this first installment of Heart to Heart. Thank you for watching, and a big thank you to our HeartMates community for sending us their questions. And if you'd like information on how to become an Abbott HeartMates team member, please visit abbott.com/heartmates. We'll see you next time. Thank you and goodbye.